My name's Dr. Blake Wynia. I'm a urologist with Prisma Health, regional urology, and I do specialize in men's health. So I treat erectile dysfunction. It's a big part of my practice. I also treat male infertility, Peyronie's disease, and prostate issues as well. I did my medical school training at the University of North Carolina, go Tar Heels, went there for undergrad as well, so I'm a big Tar Heel fan. Did my residency at NYU in New York. And then I did a fellowship in Albany, New York, and that was with a focus on andrology and men's health. So further subspecializing in issues like erectile dysfunction. And I've been in practice for over 10 years with a special focus on men's health. So this is just a brief overview of our talk tonight. We're going to start by giving some basic facts on erectile dysfunction, just kind of defining terms and talking about exactly what ED is. We'll go over what the various causes of ED are, and there are certainly quite a few different causes. And then after that, we'll go into what some of the treatment options are for ED. We definitely have a lot of different options, and there's no perfect option for everyone. You know, it's a very specialized practice that we have here based on your needs. And then finally, we'll go over a kind of a question and answer session if you do have any questions at the end. So just starting with some definitions in terms of definitions of erectile dysfunction. So it is the consistent inability to sustain an erection that's sufficient for intercourse. And so this can take a number of different forms. It can be, not being able to get an erection at all, which obviously prevents intercourse or other sexual activity. It can be, being able to be engorged and have a partial erection, but not one that's firm enough for penetration. Or it can be having an erection that's strong enough for penetration, but having a difficult time maintaining that erection, either to your own satisfaction or to your partner's satisfaction. And I think that's a part of erectile dysfunction that can get lost, is the importance of satisfaction for both partners, whether it's intercourse or whether it's, other forms of sexual activity. Some quick facts about the prevalence of erectile dysfunction. It's very, very common. About 30 million men in America suffer from some form of ED, which works out to about 1 in 4 of every adult man. And it's a little bit complicated in that the ability to get and sustain an erection is somewhat separate from the ability to orgasm and to ejaculate. And the reason for that is because those two functions are based on different parts of the nervous system. So one part of the nervous system and the machinery associated with that is responsible for actually getting and maintaining an erection, whereas a completely different part of the nervous system is responsible for having an orgasm and ejaculating. So while some men with ED can still have an orgasm and you can still be fertile and still produce semen, it often is difficult to do those things if you're having a hard time getting or keeping an erection. We do need to remember that ED, although it's very, very common, it's not normal. And although it does commonly happen as men get older, it shouldn't be seen as something that's inevitable or unavoidable. And then the important thing to remember is that no matter what, we always have a good treatment for erectile dysfunction, no matter what the cause, no matter how long you've had it, and no matter what other sort of therapies you've tried, we always have some good treatments available. For most men, ED is caused by either a physical problem or disorder. Certainly in a certain population like younger men, say men under age 35 or 40, there are a lot of psychological influences on erectile dysfunction. But for the vast majority, for over 80% of men, ED is from some sort of physical problem. And so identifying these physical problems that can lead to ED is very helpful because to a certain extent, focusing on those individual problems can help us treat your ED a little better. So some examples of different causes of ED include brain or spinal cord injury, certain systemic diseases like diabetes or heart disease. Those definitely play a big role, and we'll get into those in a little more detail in a minute. Certain surgeries like a prostatectomy for prostate cancer can definitely give you problems with erections, and then other surgeries as well in the pelvis and that area of the body. For example, if you've had colon surgery, something like that, that can disrupt the nerves that control erections and can lead to erectile dysfunction. And then finally, substance abuse. So particularly tobacco use, alcohol, all of these things when done in excess are going to lead to problems with erections as well. So let's talk a little bit about ED and cardiovascular disease. So we'll go into how the erections are formed, how we make an erection, but the important thing to remember is that erection is a consequence of blood flow, and the penis is a vascular organ. It's got a lot of blood vessels in it. If you have erectile dysfunction, sometimes that can be kind of the earliest sign that you might also have cardiovascular disease. We sometimes refer to it as the canary in the coal mine. Endothelial dysfunction refers to the blood vessels in the penis and how well they're able to open or close. When you get an erection, the arteries within the penis are supposed to open up. So the endothelium, which is the lining of the artery, is supposed to relax, which opens up the artery and blood flows in. So if the endothelium is unable to relax and blood can't come in, you can't get a good erection. We know that the arteries that are in the penis are much smaller in diameter than the arteries in the heart. So if you're having problems with erections, that might mean your arteries in the penis are having problems. And so you're going to have those problems first before you would have problems with the bigger arteries in the heart. And so that's why we sometimes refer to erectile dysfunction as an early sign of potential cardiovascular disease. Some of the other categories of risk factors for ED include aging. Although we mentioned earlier, it's not inevitable that you'll get erectile dysfunction as you get older. Aging definitely plays a role, and unfortunately, that's not one of the things that we can control. Certain chronic diseases such as high blood pressure or hypertension, diabetes, which, amongst these different medical problems, diabetes plays one of the biggest roles for sure. And we'll talk about that in a minute. Psychological diseases like depression, anxiety, or even just high stress can cause erectile dysfunction. And we just talked a little bit about cardiovascular disease. Certain medications can also contribute to erectile dysfunction. Blood pressure medications are kind of notorious for this. And amongst the blood pressure medications, the categories that can affect your erections the most are thiazides and beta blockers. So we always like to identify whether patients are taking those medications when we take a history, and talk to your primary care doctor about whether there are alternatives that you could be on for your blood pressure that might affect your erections a little less. And then finally, we talked about lifestyle issues such as stress, alcohol abuse, smoking. All of these can affect your erections as well. So let's talk a little bit more about aging in general. There are a lot of different reasons why aging can impact your erections. Certainly there's a progressive decline in your sexual physiologic function, but all of these other chronic medical diseases like high blood pressure, diabetes, high cholesterol that can affect your erections, all of those increase as men age. Psychological issues such as depression, anxiety are not uncommon as you get older as well. And then finally, relationship and partner issues can play a role as well. You see here the most frequent reasons for office visits to a primary care physician for men aged 45 to 64 are diabetes, high blood pressure, and high cholesterol. And all of these can affect your erections, as we've mentioned. So let's talk a little bit more about diabetes and high blood pressure. So diabetes, in my opinion, is one of the one of these chronic medical conditions that can affect your erections the worst. And so the higher your blood sugars are, or the higher your A1C is, the harder it's going to be to get and keep a good erection. And it's kind of a stepwise fashion. You know, at an A1C of 6%, your erections are going to be better than at an A1C of 7%. And at that level, your erections will be better than an A1C of 8%, and so on and so forth. So the better you can get your blood sugars under control, more easily you're going to be able to get and keep an erection. The longer you've had diabetes, the more it can affect your erections as well. The older you are, if you have diabetes, it's going to affect your erections more. And then finally, there are all sorts of different complications of diabetes, like having nerve problems or affecting your blood vessels in general, that can also worsen your erections. With regards to blood pressure, a high percentage of men with high blood pressure will report some form of erectile dysfunction. And as we said just a minute ago, a lot of the medications used for high blood pressure can also affect your erections. This just kind of goes over just how much all of these different chronic medical conditions can affect your erections. So we see here that diabetes is probably the worst. Prostate disease mostly refers to, prostate cancer and having treatment for that, which we'll go over a bit in a minute. Peripheral vascular disease, also very, very harmful to your erections. And then we talked about cardiovascular disease, high blood pressure, and high cholesterol as well. For prostate cancer, like I said, it's not really prostate cancer itself that affects your erections. This is kind of a common misconception. So prostate cancer treatments can definitely affect your erections, but the prostate issue itself does not really affect your erections. And so it's a very common question that I get for either men with prostate cancer or men with just a benign enlarged prostate is, how much is that prostate issue affecting your erections? And the answer is the issue itself is not affecting your erections very much, but it's the treatment for prostate cancer that can. So when you have your prostate removed, for example, for prostate cancer, the nerves that control your erections are right next to your prostate. So when we remove the prostate, those nerves get stretched and traumatized and damaged a little bit. And so that leads to at least temporary difficulties getting erections afterwards, and sometimes can be long lasting. But that's where we come in with the various treatments we're going to talk about in a few minutes. For radiation therapy, it's typically not an effect that you would notice right when you're getting radiation, but the cumulative effects of radiation can accumulate over the next years to even decades, which basically damages the blood vessels in the penis and prevents good blood flow and prevents good erections. With regards to smoking, we do know that there's kind of a stepwise correlation between how much you smoke and your erections. So basically, the longer you've smoked and the more cigarettes you smoke every day, the harder it's going to be to get good erections. And we think that this is mainly due to a relationship between the smoking and the ability of those blood vessels to relax. So that's what they're referring to here in terms of the endothelium-dependent smooth muscle relaxation. We do know that quitting smoking, even if you have a past significant history of smoking, is helpful for your erections. So, if you are currently smoking and you think that all hope is lost, that's not the case. Definitely quitting will eventually help. We talked a little bit about medications in terms of thiazides and beta blockers, which are blood pressure medications, but there are other forms of medications as well. A lot of patients are on gabapentin for nerve-related pain. That's one that can definitely affect your erections a lot, as well as a host of other meds. So just a little bit about the pathophysiology of how an erection occurs. It's kind of it is an involuntary reaction, but it's this complex cascade of things that has to be in order and has to be working well in order to get a good erection. So it starts with sexual stimulation and excitement, which is then interpreted by the brain, which sends a signal down the nerves and through the heart to the penis, which basically results in relaxation of the smooth muscle. So the smooth muscle of these arteries relaxes, and that allows blood to flow in. So the blood becomes trapped in these two spongy chambers in the shaft of the penis. Those are called the corpora cavernosum. So the blood gets trapped in there, and it actually kind of blocks the outflow. It blocks the venous outflow of blood, which helps you sustain an erection. So as these chambers fill up with blood, they expand, penis becomes firm, and you get an erection. So now let's talk a little bit more about some treatment options for erections. One of the first things that most men try are oral medications. So probably many of you who are listening today have tried these as well. That includes things like Viagra, Cialis, Levitra. There are a few others on the market as well. There's Stendra is one example. These medications used to be very, very expensive. More recently, Viagra and Cialis have both become generic, and so they are a little more easy to obtain. So there are a few things about the oral medications. For some men, they do work well, but there are definitely some downsides. So it does not provide an automatic erection. You still have to have stimulation to be able to get a good erection. For a good number of patients, they are not very effective. You do typically have to plan by taking the medication 30 to 60 minutes before sexual activity. And sometimes that's not ideal. It's certainly not the most romantic thing in the world to have to plan for sexual activity. There are small, low dose daily versions of Cialis, but honestly, it's such a low dose that for many men we see, it's still not enough. And then you can get various side effects, things like headaches, facial flushing. You can get muscle or back pain, especially with Cialis. And so they're not totally benign. And then for a small subset of men who have cardiovascular disease, if you also have a prescription for nitroglycerin, which goes under the tongue, they can potentially be very, very dangerous because they can bottom out your blood pressure. So that brings us to penile injections. You may or may not have heard of these. So these are basically, it's a teeny tiny little needle, and it's an injection in the side of the penis. And you use this medicine about 5 to 10 minutes before sexual activity. And it is somewhat automatic. It's definitely more automatic than the oral medications are, but it still does help to have stimulation. When we start patients on the injection therapy, typically we will teach you how to do it here in the office. And so we'll actually give you an injection in the office to make sure it works okay and make sure you're comfortable with it. And then based on that, we would give you a prescription. So for some men, injections do work well. It's generally not a long-term solution. So most men who at least have initial success will find that over time, it starts waning in its effectiveness, and we have to bump you up on more and more concentrated medicine. And the reason for this is that the chronic medical problems that cause erectile dysfunction are accumulating over time and getting worse. And so it takes more and more of this medicine to be able to respond. And a lot of men will reach a point where the injections don't work anymore. There are definitely some disadvantages. So again, a lot of men get kind of turned off by the prospect of putting a needle in their penis, which is understandable. You can get pain at the injection site or bleeding if you hit a blood vessel as you're doing the injection. There is a possible risk of priapism, which is an erection that lasts greater than 4 hours and can be very painful. That's a urologic emergency, and you have to go to the emergency room and have some procedures to relieve that are not the most pleasant in the world. We talked about the fact that it requires training and can cause bruising. Very rarely you can develop scar tissue after these injections, which can lead to curvature, which is also known as Peyronie's disease. Like I said, it's poor long-term tolerability. So many men, it doesn't work long-term, and it's again not the most natural thing in the world to put a needle in your penis. Vacuum erection devices are another advantage, or excuse me, another option. So this is basically a plastic tube that goes over the penis, and there are various models. Some are hand pump and some are electronic, but the basic gist is that when you use this pump, it brings blood flow into the penis and creates an erection. You typically do have to wear a little ring at the base of the penis to keep the blood in. And so one advantage is that it is on-demand use. It's non-invasive. It's generally safe. It's a one-time cost, so that's nice as well. And they can range anywhere from about $75 for the most basic models all the way up to $500 or $600 for the Cadillac versions. And they do require training as well. But in terms of the disadvantages, a lot of men who get erections with the vacuum device will find that it's not, it's not a very natural feeling erection. There's definitely a high learning curve to learning how to use it correctly, and it can affect your ejaculation as well. So for a small portion of men, the vacuum device works well, but I would say for most men, they're not entirely satisfied with it. Insertable drugs, this mainly refers to a urethral suppository. So the trade name for this is called Muse, M-U-S-E. So it comes with this little plastic applicator system, and there's a little pellet of medication that's in the tip of that applicator. So what happens is when you're ready for sex, you use this about 5 to 10 minutes before, just like you would with the injections. So you put the tip of this little plastic applicator device in the tip of your urethra and press a button. And when you do that, the medicine goes into the urethra, it gets absorbed in your urethra, and then it helps give you an erection. And so, there's a very small subset of men that this works well, but in our practice, we tend not to use it quite as much for a few reasons. Number one, it's generally pretty expensive. It's hard to find an insurance plan that will cover it. Number two, it doesn't work quite as well as the injections. So the erection that you get is not really as strong, and usually you have a little more hard time maintaining. And then finally, you can have a lot more burning with urination. So we generally don't use this quite as much as some of the other therapies. So that brings us to the penile prosthesis. So the prosthesis, there are several different types that you may have heard of. It's a small surgical procedure to put these in. This is a permanent solution. And the first type that we always talk about is the malleable penile implant. So basically, you can see a diagram in this slide of the malleable implant. It's basically these two rods that are firm, and in a small surgical procedure, we place those inside the penis, and we place them in the corpora cavernosa, which is the area that fills up with blood when you get an erection. So after you have these implants placed, your penis is always firm. It's always hard and ready for sexual activity. And they are malleable, so you can bend them into a comfortable position within your pants and conceal them. And so it's very simple to use. We do use this for men who have maybe poor manual dexterity and are unable to use the inflatable type of prosthesis, which I'll talk about in a minute. And it's not very expensive as well, but the obvious disadvantage is that your penis is always firm, and so it's not the most natural sensation. But let's talk a little bit more about the inflatable penile prosthesis. The basic idea behind this prosthesis is that it's two cylinders. They're silicone cylinders, and they're implants that go in the same place in the corpora cavernosa within the penis. And they're kind of like balloons. So normally there's nothing in these balloons and your penis is soft and flaccid like normal. When you're ready for sexual activity, there's a small pump that's located within the scrotum. So it's also internal, and it's next to your testicles. So you find this small pump with your hand, and generally you want to hold it with your thumb and your index finger. You find that pump and you squeeze it. And by squeezing that pump, it brings saline or salt water into the cylinders within the penis. So the cylinders fill up with that saline and they get firm and hard. And when that happens, it gives you an erection. And the saline stays there in the cylinders until you release it. And you still have the normal sensation and pleasure of intercourse. You can still ejaculate and have an orgasm. And then whenever you're done and ready to release it, there's a small button that's also on the pump. It's basically a release valve. So you press that little button and you squeeze your penis, and then the saline goes out. And the saline is stored in a third part of the device, which we call the reservoir. So the reservoir is basically another small balloon. And typically that's either placed next to your bladder in your pelvis or under your stomach muscles. And so it's an easy to use device, and it's definitely the most natural in terms of a physiological erection. It feels just like a real erection. It does expand the girth of the penis. It feels soft when it's deflated. And so, patients who have the inflatable prosthesis are very happy with it. It's about a 90 to 95% satisfaction rate. And it's also about a 90 to 95% satisfaction rate for patients' partners too. Obviously, there are some risks of penile implant surgery. Every surgery that you would go through has potential risks. Some of those risks include an infection. It's a small risk. It's only about a 1 to 2% risk of infection. But if the device gets infected, unfortunately, it needs to be removed. Typically, when we remove an infected implant, we're able to replace it with another at the same time. It is permanent, like I mentioned. If the implant were to ever be removed, it would be very unlikely to be able to get a natural erection again. There's always a very, very small risk of the implant eroding tissue next to the implant or moving to a certain part of the body. A small percentage of men will have some chronic pain, or the device might not work like it's intended. But for these issues, typically we can diagnose that issue, what the problem is, where the malfunction is happening, and correct it. In terms of insurance coverage for the implant, it's a little bit surprising, but most insurance plans, and including Medicare, typically do cover the procedure. And so you end up paying usually just whatever sort of copay you would have for any surgical procedure. And if it's for whatever reason not covered by your plan, there's always the option of appealing the decision, and then we always have certain alternative financing options that we can discuss. We're going to skip this here, and we're going to go to questions and answers in just a second here. One thing to remember is that penile implants, to place an implant, you need to find a urologist who's experienced in placement. With this surgery, really, experience is everything. And so you're going to have the best outcomes if you have a physician who's experienced. Here at Prisma Health Regional Urology, we have 2 physicians who place implants. I place them myself, and my partner, Dr. William Flanagan, also has placed many, many implants. So if you're interested, then we're always happy to talk about these with you.